Hello, everyone. Welcome to the webinar. I'm Anovi Schoonover, Operations Specialist at Redband Consulting, and I'll be hosting this event. Before we begin, for those who may not know, Redband is a nonprofit organization that provides tribal technical assistance on a variety of programs, including but not limited to tribal government's comprehensive, responding to urban natives, and elder abuse. This ranges from policy review via email to site visits. If you are interested, you can contact me at hanovi@red-wind.net. That's HONOVI at red-wind.net. You can also visit our website at red-wind.net for additional information on services we provide, upcoming events, and resources such as handouts and guidebooks that you can download. As this states, this project is supported by grant number 15J OVW 21 GK 02197 STOP, awarded by the Office of Violence Against Women, U.S. Department of Justice. The opinions, findings, conclusions, and recommendations expressed in this publication, program, or exhibition are those of the authors and do not necessarily reflect the views of the U.S. Department of Justice. Presenting with us today is Amanda Watson. This event does have captioning, which you'll need to manually turn on from the menu. The button looks like 2 C's. If you have any questions or comments, you can put them into the chat box or the Q&A section at the bottom of your screen, or you can click the hand icon. You'll all be muted, so if we see the hand, we can then unmute you so you can ask your question or say your comment verbally. If there are any tech issues, you can send a private message to me and we'll try to get it resolved as soon as possible. And I will now turn it over to Amanda.
Great. Thank you so much, Anovi. Very excited to be with you all this afternoon. As he said, my name is Amanda Watson. My pronouns are they, them, theirs. I'm Kanaka Maoli, Native Hawaiian, and I currently work with an organization called Praxis International. And today, very excited to be able to have a little bit of time with you all to talk through how we can go about strengthening our services for lesbian, gay, bisexual, transgender, queer, two-spirit, and questioning survivors in our communities, knowing that there are some really specific needs that survivors from the LGBTQ two-spirit community might have that sometimes our programs might not always be structured to meet. So I will just reiterate again that throughout today's webinar, I really encourage everybody to post any questions or comments that you have in the chat. I know I've seen several folks have already been sharing in the chat, introducing themselves. So it's lovely to have you all here and to get a sense for where everyone is joining from. This webinar really is meant to be a time for us to be able to talk through and think through whatever is going to be most helpful for you all based on what you're currently seeing in your programs or what questions you have about how you can strengthen your services. So I certainly have plenty of content that I can take us through, but also am happy to take some detours and tailor things slightly based on what you all are looking to get out of the session today. So I will say in a couple of seconds, I will ask you all if you do have questions or particular hopes for today's webinar, I'll invite you to share them in the chat, but I'll give you a minute to think about that and give you a quick bit of background on who I am and who Praxis, the organization I work for, is. So I've worked with Praxis for about 5 years now. We are a national training and technical assistance provider through the Office on Violence Against Women. We work with domestic violence, sexual assault, and dating violence programs and advocacy organizations across the country, and provide a wide variety of training and TA in order to support advocacy programs and advocates in meeting the needs of survivors in their communities. So you'll see up on the screen the names of a few different programs that we offer, but we are also available for ongoing individual technical assistance that you're always welcome to connect with myself or Praxis about for any questions you might have related to today's webinar content or otherwise. And my background in terms of how I came to be doing this webinar today is that before Praxis, I worked for a number of years with the Minnesota Indian Women's Sexual Assault Coalition, who's both the Tribal Sexual Assault Coalition in the state of Minnesota, but also national training and technical assistance provider for the tribal unit through OVW. And so had the opportunity to be able to work in our communities and really figuring out how can we create services and supports for survivors and address violence in our communities in ways that reflect who we are as people and the needs of our communities, rather than trying to either replicate what mainstream or non-Native programs are doing or adopt kind of a one-size-fits-all approach that oftentimes creates gaps for survivors in our communities. And so I'm always very grateful to be able to be back in spaces with other Native folks and to spend the afternoon with you all today. So I will say in the chat, you're welcome to use the chat or the Q&A feature. Either is great. I kind of keep an eye on both of those throughout webinars that I do. But if you are coming into today's session and you have questions, things that are on your mind based on what you're currently seeing in your advocacy programs or in your communities, or if there's anything specific that you're hoping I'll be able to address content-wise, please go ahead and share that in the chat. I am happy to kind of try to weave in as much as possible any specific things that you all are looking for as the participants today. This webinar is generally, I think, less focused on providing kind of foundational or 101 level information on working with LGBTQ and Two-Spirit survivors. For today, really, it's going to be more so looking at how can we develop processes for our programs that allow us on an ongoing basis to be able to assess the advocacy that we're currently offering and the services we currently provide and figure out, are those services meeting the needs of survivors? And specifically thinking about survivors in our communities who, in this case, might be LGBTQ or Two-Spirit, but you can apply this process for survivors from all sorts of different communities as well, thinking about survivors with disabilities, deaf survivors, and so on. So if you do think of anything that you're hoping I touch on, or if at any point I say something and you'd like to hear more about it, feel free to chime in the chat. So when I talk about advocacy in today's webinar, we're really thinking about it in a couple of different contexts. We talk at Praxis about three kind of distinct but also interconnected levels of advocacy. And we kind of break those out as individual, systems, and community advocacy. And individual, as might be easy to determine from the name, is really when we're thinking about working one-on-one with individual survivors of gender-based violence. So that's going to be, answering crisis calls, meeting up with survivors, working to figure out how to meet an individual survivor's needs. Systems advocacy is where we're going to be looking at how do we change the systems that survivors are interacting with. So if we think about law enforcement, and perhaps there's a procedure that law enforcement has been using when interviewing survivors of domestic violence that is causing some unintended harm for survivors or is not getting the evidence that's needed to then successfully prosecute a case. If your advocacy program works with the law enforcement agency to try to update their interviewing protocols so that it works better for survivors and gets the prosecutor the evidence that they need, that would be an example of systems advocacy, where you're changing a policy or a larger practice in the system itself, such that it then is going to benefit all survivors who might interact with that system in the future. And community advocacy is where we're mobilizing the community itself. So this might include survivors, it might include elders, it might include spiritual leaders, it might include youth. It's about figuring out violence impacts all of us in our communities in all sorts of different ways. And it will take all of us being connected and figuring out how can we address the causes, the root causes of the violence that we're seeing, such that we change those conditions that allow the violence to happen in order to eradicate the violence entirely, rather than continually trying to just come up with Band-Aid solutions when the violence has already happened. So For today's webinar, I'll be talking about kind of a combination of all three of these different forms of advocacy with regards to how we structure our advocacy programs and how we might be able to make some adjustments to the ways that we structure our programs and the ways that our staff are doing their work on a daily basis in order to make sure that we're meeting the needs of LGBTQ and Two-Spirit survivors. So throughout the next couple of slides, you'll also see many different references to the content on this slide, which is mostly just to say that, I think our approach at Praxis and my personal belief as well is that we can't think about how to end gender-based violence and better support survivors without acknowledging and understanding that gender-based violence is rooted in racism and sexism and classism and colonization. And until we're able to address all of those forms of violence as well, we're never going to be able to fully address gender-based violence. And so part of how today's webinar came about and us thinking through how we can work with advocacy programs to address the needs of LGBTQ and Two-Spirit survivors was really figuring out how can we create a process that is pretty straightforward and easy for advocacy programs to take up to be able to kind of dive into looking at the ways that sometimes we might unintentionally reinforce these systems, and also the ways that we have opportunities to really shift things and do our work in a different way and create the communities that we want our young people to be able to grow up in. So today's session, you saw in the title, references program assessments for social change, which we abbreviate to the acronym PASC, P-A-S-C. And I'm going to give you kind of a short overview of when we talk about the program assessment for social change, what does that entail? Because there's a number of different steps that often advocacy programs and advocates will go through when they decide to pause and take the time to really look at how is our program currently doing, and especially thinking about the experiences of survivors from certain communities or certain identity groups who might come to the advocacy program seeking support and whether their unique needs are able to be met. So for the purposes of the program assessment for social change, it really is looking at organizational practices. So there might be some cases where it does come down to looking at an individual advocate or staff person and how they're doing their work, sometimes in a really fabulous way and other times in a way that's maybe not having the intended impact for survivors. But really what we're trying to focus on, again, is kind of the structural piece and taking the time to look at what are the things that kind of inform and guide our work and our advocacy on a day-to-day basis. Because if we can change those pieces, change the structure and those practices and policies, then that's going to have a much broader ripple effect and have a much more sustainable impact as well on how we do our work versus even something like having a one-off training. So we're really throughout the program assessment for social change also trying to keep our focus on disparate impact that might be happening to survivors. So I'll talk about some examples of what this might look like in a couple of slides, but we're really looking for where are those places where there might be a heightened degree of consequence or impact for certain survivors based on their identities or their lived experiences compared to others. And ultimately, when we think about the program assessment for social change and why we might undertake something like this, it comes down to we're all trying to figure out how we can provide the best support possible for survivors in our communities. We all want to do our best to be good relatives, to be the relatives that people in the community know they can come to when they've experienced violence or are in need of support and assistance. And to that end, we want to know about if there are any gaps in what we're currently offering, or the way that we're doing our jobs, or providing advocacy, or talking with the community. And so undertaking a process like this really is ultimately about, can we find some solutions? If we are able to see where those gaps might be as a result of going through the task, then that means we have some really concrete, tangible information to be able to then strategize about what solutions are out there, and how might we be able to, again, kind of change the structure or our practices at a program level to address any of those gaps and make sure that they don't continue happening in the future. And I just will note, Anavi, that it looks like there's a question in the Q&A about whether the PowerPoint will be emailed out. So I'll let you respond to that based on how Redwind distributes materials from webinars after the fact.
So yes, if you would like the PowerPoint, we can absolutely send it over to you. It will be in PDF form, as we do not share the raw files, but yes, we can absolutely send over the PowerPoint.
Excellent, thank you. Okay, so I think let me give you a little bit of the high-level overview of the task, just because I think having kind of this framework of what it might entail can be helpful before we start talking in more detail about some of what you might consider doing if you and your coworkers or other advocacy programs that you connect with are interested in learning more about how to work effectively with LGBTQ survivors, and how you're currently doing, and where those opportunities for strengthening your offerings might be. So the program assessment for social change really is designed as something that is not done in isolation. So it's not nearly as effective if you try to do this as a single individual, if you have coworkers or directors or other tribal programs that you're partnering with. In order to get kind of the fullest picture of how you're currently working with survivors and what feedback there might be, it's going to be helpful to have folks involved at all levels in your program. And that might include partners as well. And so kind of one of the first steps to deciding that you might want to do something like this and take a look at your services and do an assessment is figuring out who your team might be. That will kind of go through this process together and kind of be the driving force behind it. So typically, it's going to be helpful if you're an advocacy program to think about having at least one frontline advocate who's working directly with survivors, just because there's a very specific kind of daily experience and level of insight that comes along with that. But it can also be really helpful to make sure that you have somebody at the director level, somebody who's a decision maker, just because you'll need folks on that level if you end up deciding or realizing that you might need to change policies or procedures or kind of organizational practices. And again, you can also think about, are there any community partners or other tribal programs that you work closely with where it might be helpful to have somebody from one of those groups also represented on your team. It can look any number of different ways, but really it's just taking the time to pause and think through, okay, if our goal is to try to get the clearest understanding possible of how we're currently functioning and where those gaps in our services might be, who is going to be best positioned both within our program as well as within the broader community or the tribe to help us kind of clarify and illuminate those areas. So if you've got your team assembled, there's no kind of set number of people that you need to have. Again, it's flexible based on your needs and what you think will be most effective in your community. Then the next kind of several items that you see up on this slide here are really about trying to gather some foundational information and create the fullest picture possible of how your program is currently set up to provide advocacy or to provide other services if You might also be working in healthcare or other areas, legal services, that sort of thing. And so starting out, you'll see mapping program services and operations. I'll say more about this in a couple of slides, but really this is about building out a picture of if a survivor comes to your advocacy program and they've experienced violence and they need some support, what is the path they might take through your program based on their specific needs and what your program is able to offer? And really thinking through and using that visual map or pathway to then ask some additional questions of, okay, so what if a survivor had this specific identity? How might that influence the options we were able to offer or what they might be looking for in terms of services? We're going to be really trying to figure out what might be key questions we're coming in with. For example, some advocacy programs I've worked with know on the front end that, okay, we've had some conversations or I've heard from survivors or community members that maybe they're not entirely sure that our program is a place that is for them, that our program knows how to work or is welcoming of trans survivors. And so coming in, that question is already kind of identified of how might our program be able to work more effectively and welcome in trans survivors. But identifying these key questions can also happen along the way. Sometimes as you're gathering information about your program, new questions will arise, which is also something I've seen happen many times where an advocacy program starts working with us and says, you know, okay, so we're interested maybe in figuring out something related to our shelter services and how we can strengthen that. But then through the course of starting to really create that fuller picture through mapping and collecting other information, starting to notice and identify like, oh, before survivors even get to shelter, there's this piece related to our crisis hotline and how calls are answered that is already creating some barriers for particularly LGBTQ or Two-Spirit survivors, so that they might not even get to shelter because the barrier is already so high just in what our protocol is for responding to calls on our crisis line. And so then that question kind of shifts away from shelter to first we've got to figure out the crisis line. And then secondarily, we'll move into the shelter piece. So once as much information as possible has been gathered, then there's obviously going to be some analysis and then the process of figuring out, so what do we do with this knowledge? What tangible, concrete changes can we make? And I think one of the beautiful things about going through a self-assessment like this as an advocacy program is that you can have a whole range of outcomes that you might identify in an action plan. There might be some things that are really small, maybe something as simple as the information that's included in your email signature for your staff, where it's a fairly quick change, something that you're able to make without too much effort required. And there might be some much larger things identified, like figuring out how to have gender inclusive or gender neutral single stall bathrooms available that survivors or community members can use. And then knowing that, okay, so that might involve construction costs, that might involve looking at where the program is physically housed. That is a larger undertaking. And so might be a longer term goal or effort. But that whole spectrum from really small things to the really big things can really set up an advocacy program to have some strategic planning over what do we want to tackle right now in the short term, and then what do we want to kind of keep working on over the next year or 2 years or even longer than that, based on the information that we've gotten from going through this assessment. So I think one thing that is sometimes helpful when we think about looking at our programs, looking at our advocacy, and starting to figure out where some gaps might be, is having kind of general buckets that we're going to examine. And so with the task, we've got 4 buckets. There might be others, but these 4 at least kind of provide an initial categorization, so you can make sure that you're not missing any big chunks of information that would be helpful to you. So first is looking at the building that your advocacy program is in, any physical spaces. This might also include community spaces or outdoor spaces where you might hold events or connect with the community and survivors, but kind of those really just the physical areas themselves. The second area is going to be looking at policies and procedures. So again, with your advocacy program, kind of the documents, the practices that underlie everything that you do and guide everybody's work with survivors as well as on the administrative level. And sometimes some of this might be specifically for an advocacy program where it is your policies and procedures, but oftentimes, depending on how you're situated, if your program is within a tribe, there may also be additional tribal policies or procedures that will also need to be taken into account. The third area is looking at the specific services that are offered to survivors. And often that can seem like of course we're going to look at that. It seems like the main thing you would look at if you were trying to assess how your advocacy is doing. But it really is just one piece of the bigger picture for how your program is engaging survivors and creating an environment where they feel welcome and supported from the get-go. And partnerships is similar in that it's not always even just about you and your program. The community also is going to be noticing and paying attention to and taking into consideration who you have partnerships with and how those partnerships and relationships function. Do you have really close, meaningful relationships with other queer or two-spirit local groups or organizations, or do you not? How are your partnerships with other service providers in your area, thinking about, for example, mental health providers? And do you have enough relationship or awareness to be able to determine whether those providers are going to be able to work effectively and in a non-biased fashion with LGBTQ or two-spirit survivors who might seek mental health support from them? So we're going to talk more about each of these areas and some possible examples that might come up or changes that might be identified. But just wanted to lay these out kind of from the get-go so that you all can kind of be thinking already about your own programs and what it might look like to consider some of these areas and assessing the experience that survivors might have as they interact with your program and seek support. So as far as gathering information about your program, services that you're offering, the experience that survivors are having, there's really 3 areas that we're going to look at, 3 kind of activities that you'll undertake, I guess. And that is mapping and focus groups and document analysis. And these 3 information gathering strategies will really set you up to be able to have a pretty complete picture of what's working and what's maybe not working quite as well as you would hope. So I'm going to start with mapping. And I know it was mentioned that the PowerPoints can be sent out if you drop your email in the chat, but also, regardless, I'll have on another slide a slightly zoomed in version of this because I know it looks like just a bunch of tiny little boxes on the screen right now, even if you have a large computer monitor. But mapping, as I mentioned earlier, is really going to be a process of going through and figuring out, okay, if a survivor comes to our program, what are all of the different pathways that they might move through our program based on their needs and their identities and what our program is able to offer and how our program is structured to function? And so lots of tiny boxes up on this slide, but it effectively is really kind of just a large flow chart that in this case, this was a map that was actually created by an advocacy program that I worked with, where they started little tiny box up top of how does a survivor initially connect with our program, and identified 7 or 8 different ways: crisis hotline, walk-ins to their physical office, referrals from other providers, a call from law enforcement, being asked to meet a survivor at the hospital for a forensic exam, and a handful of others. And then for each of those, kind of followed through and said, okay, so if a survivor calls a crisis line, what happens next? Who answers? How many staff do we have in rotation for answering crisis calls if we have a crisis line? And what guides the person in how they answer the call? Is there training they've received? Do they have a manual? Is there a script of what should be said to open up a call with a survivor? Are there notes taken anytime a crisis call takes place? How are those notes stored? Who has access to them? Many kind of follow-up questions that can happen there that then also lead to additional questions about each of those areas, and thinking out, okay, so then at the end of the follow-up call, at what point is an intake done? Or at what point in a crisis call would an intake be done? Is there follow-up after a crisis call that happens in a specific way? And then moving into, if an intake does happen, what does that process look like? Are there forms that are used? Is an intake always done in the same fashion? How is information that's gathered during an intake stored and shared across different advocates if you have multiple staff working in your program? And really the goal, again, is just to make visible all of the things that go into the daily functioning of your advocacy program, because there is a huge amount of knowledge that advocates and all staff kind of keep in our heads of, okay, so, you know, if a crisis call happens and I do this, and then I do this, and then I do this, and then these other things come into play, and then I loop in my other coworker here, and here's, you know, the system that we use for tracking data points for our reporting. There's a lot that lives in heads, but which is great and can make it challenging to really figure out where might there be consistent gaps happening, or where might there be differences based in what each individual staff person has in their head as what the protocol or procedure or practice should be. And so mapping in this way creates the visual of here is all of the different work that is happening on a daily basis. And it makes it much easier to then, as you zoom into particular sections, ask more targeted questions about how survivors from a particular community, like LGBTQ or queer survivors, might move through this flow in a similar or maybe slightly different way. And it can, having that visual representation, I think can just be helpful for advocacy programs and advocates in general as kind of an objective, like, look, there is a huge amount of work that happens on a daily basis. So much specialized knowledge is needed to be an advocate and to do this work in a good way. And oftentimes for folks who are not advocates or are not working closely with advocacy programs, it can be hard to communicate all of the different moving parts that come into play. So having something like a map in this sense can be useful for that. But again, it also allows you to decide, are there things that you might want to color code? So for this program, they had decided that blue boxes would be kind of just like general information about steps in how they would interact with the survivor. But then they color coded all of the yellow boxes so that anytime there was a form or a written document or a database that was utilized, anytime notes were taken, they made those boxes yellow so that then at a glance, again, they could look at their chart and say, okay, where are the yellow boxes? Because that means there's forms that are involved that might be helpful to look at and spend some time with figuring out, is the form serving the purpose that we need it to? When was the last time the form was updated? Are there ways that we might be able to tweak the form or the way that our staff are using the form such that it will create better outcomes for survivors? So this mapping process is fairly extensive and can be a large undertaking, but it is also really helpful to have as kind of that baseline for how your program is functioning. Some programs that we've worked with have ended up laminating their big maps and putting them up on a wall. And then every time, like once a month at a staff meeting, they take a different section of the map to kind of revisit and say, okay, is this still accurate? What's listed versus how we're doing our jobs on a daily basis. And also, let's take a moment to think through a particular identity group or community that we know comes to us for support after they experience violence, and figure out, are there any things that maybe wouldn't work as effectively here? So an example of that would be with the crisis line calls. One program had kind of a general flow of survivor calls, here's who answers, then this happens, and then that triggers, this other thing to begin, and then a follow-up takes place. And it looked like, okay, yeah, that's accurate. It reflects the way that our job is done on a daily basis. But then the program paused and said, okay, now let's think through how this would look if it was a deaf survivor who was reaching out to us. And suddenly that raised a number of different questions about, oh, okay, so how would our crisis line handle that? Like, what options do we have? Is there a national provider that we outsource to who has technology to more effectively answer calls from deaf survivors? How does that happen? How do we get looped in then? And then again, kind of following it through even the follow-up of, okay, do we have access to American Sign Language or ASL interpreters if a deaf survivor ever came to our program for services? Or do we have relationships with an interpreting agency? And so I think, again, the maps are a baseline and also provide a really useful jumping off point to be able to do that really focused analysis of how survivors from specific communities or identity groups might experience your program differently than kind of the quote unquote default survivor that your program might have been built around serving. And it also can be really helpful to illuminate where there might be confusion even among staff about what the proper approach or response is, or what options are available, what paths can a survivor take through your organization. So both on the survivor experience side, but also on the staff and program advocate side, going through this process can lead to a lot of different insights that then will help inform what else you might want to do next in your data collection. All right, so before we go into the document analysis piece, I do want to just flag another information collection strategy or method that could be used, which I don't think I have a separate slide for here, but is super helpful, which is focus groups or talking circles or listening sessions. Anything where you're creating a space to be able to hear directly from survivors and the community itself about their experiences and what their thoughts are. And that can be so useful in so many different ways. And you can structure it however it makes sense for you and your program and your community. Sometimes we've worked with programs who did focus groups They advertised in the community and said, if you've ever experienced violence and did not come to our advocacy program or did not seek services, we would love to have you participate in this talking circle with us so that we can hear from you about, what resources did you access or what do you wish you could have accessed? And to hear from survivors who never interacted with an advocacy program about why that was. And what it was that they were looking for or wish they could have had. Just knowing that you'll get very different responses from survivors who've never been in contact with your program compared to survivors who have worked either briefly or more extensively with your staff. And all of it is really useful information, but it's mostly about figuring out what will most help you identify where those gaps might be. And obviously, in this case, talking to survivors who never contacted your program can be really useful to figure out, is there a gap or something specific that is causing some survivors to say, no, I'm not going to call this advocacy program, or they're not a resource for me, because that then is something that can be changed or addressed in different ways if you're able to learn more about what that might be. So for the talking circles or focus groups, again, I think many different communities have different practices around what you might call something like that, and if there's any cultural protocols that you might use. So tailor it to your community. But really, I think one thing about the mapping is that you may identify areas where, if we were to go back here, if you look at the map, you say, wow, like there's a ton of boxes, a ton of steps and things that have to happen in this one section of the map around, maybe it's about getting into shelter. And I wonder what the experience might be for survivors who are going through that. Does it feel overwhelming to them? Are there things that stood out to them that either worked well or didn't? And that might then help guide you towards a focus group or a talking circle that you might want to do so that you can hear from survivors. And we're not trying to guess about what a survivor's experience might have been or what they might like to see done differently. We're able to really just connect with them and work together to figure out how can we strengthen things. So I do want to go into the Q&A though. I see that there is a question that's been sent in about how can we facilitate similar process mapping activities if there are several group-specific advocacy programs within our department that provide services to survivors. Any tips? And this came in as an anonymous question. And I'm not, if you want to add more detail, that's lovely. To clarify this group-specific advocacy programs, I'm not sure if you mean like if there's a youth advocacy program and a gender-based violence advocacy program and maybe an elder advocacy program, and they're all providing services in different ways and how to kind of map all of those. Or if you meant, okay, perfect, I see correct, come in. Great, yeah, so you can do something similar to this. One program that I did mapping with it was a sprawling umbrella of different kind of group-specific services, some of which were advocacy-specific around gender-based violence, but then there also was some transitional housing. There was some youth advocacy, not necessarily directly connected to gender-based violence or child sexual abuse. There was legal advocacy. They had a medical advocacy wing. And so if we had mapped all of that on a single map, it would have been quite large. But so the approach that we ended up taking after kind of thinking through like what would be most helpful was we started out and each branch or each group specific program kind of did its mapping initially. So figuring out, for example, starting with the domestic violence advocacy program, they created their map and they flagged on their map, they color-coded boxes or put little stars next to the places where then they might overlap with other programs that were group specific, that were under kind of the umbrella of their overarching organization. So that then they could connect with, say they identified, okay, and here's where we would overlap with the child and youth advocacy group that is a totally different team. Like, we don't really interact closely with them on a daily basis, but there is overlap, and it's impossible to fully map, and figure out where gaps might be without also mapping them. So they would star that, and then the child and youth group, advocacy group, would create their own mapping and figure out, okay, so where is the overlap for them with the domestic violence specific group, and create their own stars. And that helped illuminate some interesting, what's the word I'm looking for? Disagreements isn't quite it, but some disconnects where maybe the child and youth advocacy group indicated, like, here's where we think we overlap with the domestic violence advocacy program. And that was not somewhere where the domestic violence advocacy program had indicated that they saw overlap or a connection in the services that would be offered. And so that was good information to figure out, okay, how can we make sure that everybody internally is on the same page? And then also thinking through, what is that experience like for survivors who might experience that kind of disconnect? But then it also helped create a through line so that you could kind of go from one map to the next to say, okay, so if we start, say, in the domestic violence, but then something happens that intersects or overlaps with the work that the child and youth group is doing, you could kind of follow that path from one map over to the next, and then see sort of the full process that that survivor or individual might go through. So that's just one approach that we've taken, where you're not necessarily trying to get every single person all in the same room to create one giant map. Sometimes with assessments like this, it can be helpful to kind of piecemeal a little bit, break it down into bite-sized chunks. But it also depends on kind of the working relationships you have, and maybe in your community, you would say, like, actually, I think it would be more helpful if we got everybody into the same room and just like blocked out a solid day or two to try to work together to all create this map. And there can be merits to that approach as well, because then you are having the chance to kind of hear where those misconceptions or confusion might be about what each individual program's role is, and the work that they're doing and how they interact with survivors, and can kind of clarify some of that as you go along, and really have everybody on the same page then, and have each person then end up with kind of that fuller understanding of the full sum of all of the collective work that's going to be done. And as a result, then the meaning that might have for a survivor who could be in contact with multiple of those advocacy programs. So if there's anything that would be more specifically helpful, yeah, feel free to chat in or drop in the Q&A. That's a great question. And I know it's not an uncommon challenge. So thank you for raising it. Okay, so we've talked a little bit about mapping, talked a little bit about focus groups or talking circles or listening sessions. One thing before I do document analysis, just to go back to the focus groups, is that it can be helpful to think through and be strategic about who you want to facilitate or lead those focus groups or talking circles. Sometimes it can be really helpful to have it be somebody from your program, but other times it might be more effective or more appropriate if you have an elder in the community or somebody else who's not part of the advocacy program itself, who can hold that space and guide people through the conversation in a good way, without then it feeling like there's quite as much risk of, oh, if a survivor says something critical about the advocacy program, then maybe a staff person is going to take it personally and not help them in the future or treat them differently or something like that. So again, you can kind of tweak a lot of this based on what you think will work best for your community and what you know of the people in your community. This does not at all have to be, a one size fits all. This is how you do it, and this is how you have to do it. You can take take these pieces and adapt them so that they work for you. So on the document analysis side of things, this is where it can be really helpful. I mentioned on the mapping, some of the program's color coding boxes based on any time that there was like a written document or a form or a policy that came into play. And that can help expedite your document analysis, just because then you'll kind of have a ready-made list of some of the different documents that you might want to prioritize taking a look at. So it could be things that you're directly using in your work with survivors. Again, intakes, lethality assessments, things like that are very common to want to examine and look at in this context. But you can also think more broadly and think about, what advertising materials do you have? How are you publicizing your program? What is the physical decor in your office or in any of the physical spaces or buildings where you might be interacting with survivors? If you have events that you host in the community, do you have any written kind of processes that you use or practices that you follow for how you engage with the community or with survivors? All of those different things can also be part of document analysis. And really, this is a space and a time to try to kind of take yourself out of the day-to-day work, and knowing that a lot of the stuff you probably, if you're an advocate, you might see on a daily basis for sometimes many, many years. And take that step back from it and try to look at it with fresh eyes and look at it with a particular lens again of saying, okay, so if we have our intake form, great. But now let's look at the intake form, not just generally for how we think it might work for survivors. Is it too long? Are we asking too many invasive questions for the intake that we could ask at a later date or future conversation? But thinking really specifically about, in this case, LGBTQ and Two-Spirit survivors. Of some of it very basic things, like do we ask about pronouns when we do an intake or first in contact with a survivor? And if we do, is that information shared so that all staff know a survivor's pronouns? Or is it kind of like a piecemeal? Some folks on staff might not know that information or be able to easily access it. Thinking about if there's gendered language in your forms. I know a lot of lethality assessments were originally written so that there is gendered language that refers to the person causing harm or the perpetrator or the offender using he, him, or his pronouns, and the implication that the person causing harm is a man, which may be the case, but also can create kind of a liminal space for folks whose the person who caused harm to them isn't a man or doesn't use he, him, his pronouns. And so thinking through, some of those might be fairly easy opportunities to try to update the language so that it's gender neutral or gender inclusive, so that it's just one less area where somebody who comes to your program might have a moment as they're being asked questions or looking at a form or trying to fill out a form of feeling like, oh, this is not something that was ever meant for someone like me. This doesn't apply to me, feeling like maybe I'm not meant to be in this program at all or meant to be here or accessing these services. So again, it can be things big or small. And we'll talk about some specific changes that different advocacy programs have made in some of their documents here in another slide or two, I think. But just wanted to raise this in general as I think a good practice, and also something to consider if you don't already have kind of a process established of reviewing any of your written materials every 3 years or every 5 years, trying to figure out what would it take to implement something like that, so that that after a certain amount of time passes, you will always go back to re-look at any of your written materials since the last time they were updated to make sure that the language is still appropriate, that there's not any new information that you'd want to include, any tweaks you'd want to make. Just because, again, advocacy is a lot. There's a nonstop, there's always something else that needs to be done. And so I know for myself in my own experience, if I don't have, a really clear, like, okay, every 3 or 5 years, it's going to be time to look at and review and make updates to this practice or this policy, to our employee handbook, to our forms, that very quickly kind of can fall to the bottom of the priority list, just because I'm like, oh, if it comes down to reviewing a form versus working with a survivor who's in front of me and telling me they need support, like I'm going to work with a survivor. And so again, kind of trying to create that opportunity for all of us and for our programs organizationally to pause and say, okay, but it is important to invest the time in those regular reviews and updates and edits, because that ultimately will have an impact on the experience that that survivor who's coming to us for support has. And so maybe, probably still not going to prioritize it over an immediate crisis happening in the moment, but trying to create the spaciousness to at least do a quick review of your documents and any written materials for your program on a regular basis can have a large impact. So a couple of quick notes, and I think it looks like from folks who've been in the chat that most of you are working for tribal programs. I know there may also be some grantees who are not programs housed within a tribe, but are still working predominantly with Native survivors, or might be seeking to provide more services to Native survivors. And so the program assessment for social change is meant to be able to be tailored based on the needs of whatever program is using it. So it's not inherently tailored for Native survivors, but just wanted to pull out a few ways that it's very easy to make sure that's kind of woven throughout. And really it comes down to ensuring that anytime you're doing data collection or information gathering, that you're always keeping a focus on the experiences of Native survivors, but also thinking in this case about Native survivors, but also Native LGBTQ and Two-Spirit survivors. And are you asking the questions about what their specific experiences will be as they interact with your advocacy program? And are you making sure that whether you're housed within a tribe or not, that any local tribal representatives or Native community organizations or groups are represented on your PASC team? So when I talked about kind of pulling together your initial team right at the front end, you want to make sure that there's representation. And again, in this case, really think carefully about, do you have any queer Native folks in the community or on your staff or in partner programs that also might be good to have on your PASC team? Think through also who else in your region is doing this kind of work. Part of the program assessment for social change can be figuring out and identifying what are the opportunities to build relationships where maybe there haven't been relationships previously, or maybe where there's been bad relationships. There can be some really racist practices by some non-Native or non-tribal programs. Bias can pop up in different ways. And so figuring out both who are the tribal programs in your region, or service providers or community orgs that you might want to connect with, but also are there non-Native service providers and orgs that you'd want to connect with? Not necessarily even to have on your PASC team, but also just to kind of get the full picture as much as possible of what anything that connects to your program and how survivors are going to be coming into your program based on experiences they might have elsewhere, things they might have heard in the community about your program versus other programs. We all exist in ecosystems within our communities and our regions. None of us kind of exist in isolation, either as individuals or as programs. And so thinking through and being intentional about how can we have that ecosystem that we're a part of reflected in our program assessment, I think is a worthwhile process. That's not to say you have to make this big and sprawling. You don't have to involve everybody in every step. And it might also be something where you're like, you know, at this time we don't have the capacity or the resources to take on something quite that big. And that's also okay. You can table that. If you're, you know, keeping track of any outcomes or things that are on your mind as you go through the task, put that in the parking lot of, you know, it would be great at some point to explore this further. It's not something we have capacity for right now, but just flag it so it doesn't get lost down the line. If you do have more capacity or that becomes something that you want to pick up again. And really, I think the biggest thing is making sure that always at the center of what you're doing, whether when you're thinking through what questions you're asking about what happens next as you're mapping your organization in your focus groups or talking circles with the community and with survivors, when you think about the experience a survivor might have with any of your documents, make sure that those survivors, that Native survivors, that Native LGBTQ and Two-Spirit survivors are centered, and that they're the ones that you're building your questions around, that their voices are the ones that you're creating opportunities to hear from. Because those folks with lived experience are ultimately the experts in what is going to be most helpful and what they would most like to see. And again, through the task, you're going to identify not just gaps, you're also going to hear about what's currently working, the good stuff too. And so on both fronts, really having the folks who you're trying to ensure that you're more effectively serving at the center and creating those opportunities and spaces for them to share their thoughts and perspectives is vital. So we've got like, I think about 30-ish minutes left. And so I want to move into talking through some different examples of changes that have come about from programs that have gone through the program assessment for social change or a similar process in order to try to strengthen their services specifically for Native LGBTQ and Two-Spirit survivors. And so I have it divided up into a couple of slides based on procedure changes, resource changes, and policy changes. And again, I'm going to pause for just a second and invite anybody that has questions or thoughts or anything on your mind, feel free to share it in the chat or the Q&A. I know this is a lot of content that I'm probably saying very rapidly, but if you do have questions, please share them. I'm happy to address them. I'll keep an eye out in case any come in the next few minutes. So to look at some examples of changes though, as far as procedure changes, again, some things are going to be smaller, some things are going to require a larger time investment to address. And I'll say a little bit about both what the gap was that was initially identified, as well as then the change to fill that gap and ensure that the program was able to better serve LGBTQ and Two-Spirit survivors. So first up, revised process for crisis hotline answering service. So I think I alluded to this one earlier, that one program that went through the task process realized that, you know, they were kind of doing their mapping and talking through, okay, so, you know, if there's a call to the crisis hotline, you know, we use an answering service to try to balance staff workload, and the answering service makes a determination of, you know, okay, if it's male survivor, then they forward it over to this person on staff and connect them that way. If it's a woman, then they connect to this other advocate who's on a rotating shift. And the question was raised of, well, how does the crisis hotline answering service go about determining the gender of the person calling in? And after a little thinking and trying to figure it out, the realization was had that the answering service was going based off of whether the voice on the phone sounded more masculine or more feminine, which I'm sure folks, there's many ways that can be flawed, but specifically was creating a huge potential gap for trans and non-binary survivors. And it was both the crisis hotline answering service not having any way of accounting for that and making assumptions about the gender of the caller, as well as then the realization of like, oh, there's not a clear process or protocol for the advocacy program itself about who trans or non-binary survivors specifically would be routed to, because the original structure had been set up based on only assuming two genders of men and women. And so the program was able to work on revising both the agreement with the answering service about how gender of a caller would be determined, and then also figure out how to update their internal staff process for how calls were routed, to try to move away from routing calls based on gender, and instead figure out, okay, what would it take to ensure that all staff felt capable and had the training and support needed to be able to effectively answer a call or respond to a survivor of any gender. And then updating lethality assessment forms. I talked about this one earlier. This came up for a different program that went through the PASC, where they realized, as I said, lots of gendered language in their lethality assessment. And so they just went through and took out all of the gendered pronouns and updated it so that the language would be appropriate and applicable regardless of the gender. And the survivor then could indicate, and whoever was going through the form with the survivor could indicate, if helpful, any additional details about the person who was causing the harm related to the lethality assessment that was being done. And I think that's also true for lots and lots of different procedures and policies, where we'll talk more about this in a minute, but oftentimes there is not a need for gendered language or pronouns that are gendered, like he, she, his or hers. There may be limited cases where that is relevant, and in those cases you can work through that, but oftentimes it does not change the meaning, and in fact creates a broader blanket of applicability to remove gendered language where possible. So just something to consider for all of your materials and written forms and procedures. But then this third bullet up here of a procedure change, this is one that might be a slightly larger undertaking compared to maybe just updating and removing gendered language on a form. So one thing that often comes up is that there's not always a super clear protocol or procedure for how to respond to harmful comments about LGBTQ or Two-Spirit survivors or staff or community members, particularly when comments, harmful comments, homophobic or transphobic comments are made by other survivors. And there can be many layers to that, but often what advocacy programs were identifying was that maybe there were some people on staff who would feel comfortable or confident enough to address a harmful comment that was made, but many others didn't feel like they knew how to say, how to intervene, or put a halt to homophobic or transphobic comments, particularly when they were coming from other survivors, because of not wanting to alienate or make that survivor feel unwelcome. And so I think, yeah, we could do a whole training just on that. Reach out to me if you want to talk more about it, because we don't have time for that today. But I think the key thing here is to think through, okay, how can we get a proactive plan in place and have an agreement with all staff, with our board members, with anybody, volunteers who's connected to our organization, about what the expectation is for responding to harmful comments when they're made. And then to follow that up with, how do we help people build skills to do that, to intervene in those situations and feel like they have the language to do so confidently or comfortably. Maybe it might still be uncomfortable, but they feel at least able and know how to intervene if the need arises, so that it's not just, we put a plan in place and then expect people to figure it out. But how can we both say, here's how we want to respond to harmful comments in a way that aligns with our values for our program, for ourselves, for our community, and then how can we equip people with the skills so that everyone is on the same page about how to do that. So then for some of the resource changes, again, one of these I mentioned earlier about looking at gender inclusive bathrooms. And again, this is something where with mapping, this has come up with some programs of a realization that, if you look at your map and how long it can take to go through all the different steps and paths that a survivor might take over a course of days or weeks or months, even years in some cases, taking the time to pause and say, okay, so in all of the different spaces that the survivor might end up in, whether at the advocacy program or, at the courthouse, at the police station, wherever, are there gender inclusive bathrooms available? That could be specifically identified gender inclusive bathrooms, but in a pinch also family bathrooms where it's a single stall or a unisex bathroom, single stall, with a lockable door, and saying, oh, so would somebody who was trans or non-binary specifically be able to safely access a bathroom without having to be afraid of either legal repercussions or potential physical or emotional violence from other people who might end up in the bathroom with them based on the survivor's perceived gender identity. And so, again, none of our programs are independently wealthy, I don't think, and able to just build new gender inclusive bathrooms at the drop of a hat. And so there often are going to be many cases where you might say, there is not a gender inclusive bathroom available in our building, or maybe at the courthouse, wherever it might be. But once you identify that, again, put that on your long-term list, trying to figure out how to address that. But in the short term, figure out then, where are there gender inclusive bathrooms in the community? And I've worked with some programs that then ended up coming up with a list of partner organizations in the community that had single stall or gender inclusive bathrooms in their buildings, and we're happy to allow folks to come into their building to use it, specifically because of this need. Sometimes there are miscellaneous businesses, sometimes even fast food restaurants, occasionally gas stations. And so some programs have literally come up with lists of single stall bathrooms. There's also websites online that have, I think Refuge Restroom is one of them, that have maps of single stall gender inclusive bathrooms that have been identified across the country. That again doesn't account for some of the local relationships you might be able to lean on to say, like, we have this need that we've identified, how can we meet it? But it's just something to think about, that even if you can't fix bathrooms magically in the meantime, how can you at least make sure that all of your program staff and your partners are aware of what the options are, so that then you're able to share that clearly with survivors, so that they know what their options are and can plan accordingly based on their needs. In a similar vein, looking at your resource lists. These might be just internal resource lists that your staff reference, or I know some programs have kind of like actual lists of providers for healthcare, mental health, all those things that are given to survivors. Thinking it through, are there ways that you can indicate if you know which resources or other partner providers are supportive of LGBTQ and Two-Spirit folks, just because that's not a guarantee. And obviously we don't ever want to unknowingly send queer trans survivor to a provider who's then going to have bias against them and potentially interact with them in harmful or even dangerous ways. And so both, again, for your advocates and your program staff, how can you indicate if you have that knowledge? If you don't know who's supportive, think through how you might be able to try to figure out that information. And again, the realities of a lot of smaller communities, rural communities, tribal communities, is that you might not have, a surplus of options of providers to begin with. And so both thinking through, are there options outside your community that you can have just in case somebody would like to try to access that, whether virtually or in person if travel would be required. And if that's the case, then thinking through if your program has resources to support that survivor's travel. But even if not, in those cases, then thinking through how you can have that conversation with survivors about what you do know about the providers in your area. So that at least, again, we're trying to make sure that everybody has the information that they need to make informed choices for themselves and make sure that agency of that survivor is centered and always a priority. And for the last resource change example, this is a nice, small, simple one that can go a long way. One program said, okay, so we ask about pronouns on our intake form. I've tried to be better about that. But we're trying to figure out what else can we do about that to make sure that people's pronouns are respected. And especially in, cases where it's a community gathering or event that they were hosting. And they said, oh, you can get sheets of pronoun stickers. Pronouns, again, are kind of the words that are used to refer to a person in the third person. So, that's his, he went over there. She told me that. They were at lunch with me yesterday. There's many different pronoun options. And this program said we're going to get pronoun stickers and have them available so that when folks arrive to our events, they can take a pronoun sticker and we'll just include an acknowledgement of what pronouns are and why we have the stickers as part of kind of our general welcome to the event, so that we're both trying to increase community awareness and also make clear that this is something our program is thinking about, that we are aware of the importance of respecting pronouns and that we're willing to, invest in resources so that people are more likely to be able to clearly communicate both who they are and their pronouns, and then for that to be respected rather than there being assumptions made. So some of those pronoun sticker sheets are super cheap, like a couple bucks for sheets of 100 or more. So another kind of smaller, quick and easy thing, but that can go a long way towards the experience that queer trans survivors in particular, but also across the board, survivors may have with your program. Okay, and policy changes. So these are, again, these can be some bigger ones, but I think also, again, can have a huge impact. So looking at your employee benefits package, again, this may be through you or maybe through a tribe or an umbrella organization, depending on how your advocacy program is structured and set up. But figuring out if there are ways to ensure that your employee benefit package it can include gender affirming care. So thinking about things like hormone replacement therapy or top surgery. And also thinking about a lot of times most employee handbooks have things related to like sick time or bereavement leave where they talk about family members. And a lot of times either it's not clearly defined or is defined fairly narrowly as being, a spouse or a child, sometimes a parent. And one thing that we do know is that a lot of queer and trans folks have chosen families who are not biologically related to them, but are absolutely still just as important of a family member. And so I know at my own organization, even a couple years ago when we were doing kind of a recheck of our employee handbook, we expanded the definition of family and stated very clearly in our employee handbook that family includes, anybody that the employee designates as being part of their family, and it being completely separate from any sort of biological or legal relationship. And I think, again, this works both in the queer and trans context, but also when we think culturally about a lot of our communities, where family is not always limited to just a core kind of nuclear family in a very white Western sense, where it's a mom, a dad, and kids, and those are the primary people, or a spouse. And so this is another great example of how, when we try to think about how can we ensure that as many people as possible feel as included and represented as possible in our policies and our procedures, it benefits many people in many different ways across multiple communities. So that, I think, is always a good thing to keep in mind too, that there can be ripple effects in a positive way beyond even what we might anticipate. As far as shelter medication policies, I know this one can also be something that can take some sorting out to update, but thinking specifically about if there are shelter medication policies about controlled substances or non-prescribed medications. So controlled substances, testosterone, for example, is considered, I think, a Schedule 3 controlled substance, which for trans folks who are on testosterone or hormone replacement therapy, that then, depending on what your shelter medication policy is, can cause some concern or might cause problems, either for them being able to access it or being able to have it in shelter. So things to think about there, about generally what your approach is in policy to control substances. And then also non-prescribed medications, obviously, is a big concern for many reasons. For if folks have medication that they have not been prescribed, that they're bringing with them into shelter and taking or having access to. But again, when we think in the context specifically of trans or non-binary folks, there may be individuals who were not able to get a prescription for hormone replacement therapy, but were able to obtain it through other means. And so this is not to say you should just say, all non-prescribed medication is welcome, but it's something to think through carefully with your staff about how would we navigate that? How would we ensure the safety of that individual survivor, but also all survivors that are in our shelter or engaging with our program, and trying to figure that out, again, proactively, so that it's not something that only comes up when you realize that you have a survivor in shelter who's coming to your program for services who has that particular need. And I think the final piece here is, I know, a big one for anybody that has shelter for survivors, regarding how survivors who are trans or non-binary will be accommodated in shelter if your shelter services are segregated by sex. So if you have, only men are allowed here or only women are allowed in shelter, figuring out what will your program's approach be if you have a survivor who is a trans woman who comes to you for shelter and needs that service. If you have a non-binary survivor, how will you navigate that? Again, there's not going to be a one-size-fits-all approach based on, what community resources you have, what you've done previously, what space you have. But it's always good to try to figure out what your approach would be and what your options are ahead of time, so that you can get really clear in your policy, make sure that you're in compliance with any funding guidance or directives, and then make sure that all staff are clear about that as well. So that then, if and when you do have a survivor who comes to you in need of shelter who is trans or non-binary, you know what your approach will be, and you're not kind of caught off guard and scrambling to figure it out on the fly. So that, I think, is probably part of, you could sum up a solid 50% of outcomes from the program assessment for social change as figuring out how to think proactively. Bonita Ball, There's a question here of past example of a small Native community. We're actually currently working at Praxis with the Little Traverse Bay Band of Ottawa Indians up in Michigan. And they're still in the process of going through the task and completing it. They've been working with us on it for almost a year now. I think it'll be a year coming up in June. And so they're just in the final stages. So, and we've done pieces of this with other tribal programs as well around the country, but it is also a challenge it's a commitment. It's a time commitment to do the whole thing, and a resource commitment and staff time. But if anybody on this call is interested, we are always looking to partner with folks and explore how to do this either in smaller pieces or, the full program assessment for social change. So that, I think, is a good segue into, I'm going to put up here on the screen, this is my email at Praxis. Anybody, if you have questions or anything comes to mind after the fact, if you're interested in connecting further about any of this, please don't hesitate to reach out to me. Again, we're super excited to be able to do these program assessments for social change. We've had fabulous experiences working with programs around the country on it. And I know I personally would love to be able to work with more tribal programs, because I think it's very doable and there's such good opportunity here. But even separate from the program assessments for social change, if you have questions or are encountering anything that you're not quite sure how to navigate with your programs related to serving LGBTQ and Two-Spirit survivors, I'm also always happy to connect about that specifically. So you've got my contact information here. If you requested the slides, you'll obviously be able to access it that way, but also I think if you Google me, I'll come up and you'll be able to get my email that way as well. So we're just about at the end of our time. We've got like 3 minutes. So if anybody has any final questions or thoughts, happy to answer them now. But otherwise, I just want to say thank you to Redwind for hosting and allowing this webinar to happen. And thank you again to all of you for taking the time to be here and for being so committed to doing this work for people in a good way. So hopefully our paths will cross again soon, whether virtually or at an in-person conference or other training event. But for now, I will say goodbye to all of you and thank you. And I hope you have a wonderful rest of your day. Thanks, everyone.
Thank you, Amanda. So we'll give just a few seconds for people to ask any questions or comments before we wrap up. All right. Well, thank you, Amanda. Before we end the session, I want to let you all know that there will be an eval popping up once Zoom closes. We'd love to hear what you thought, so if you're able to fill that out, we'd very much appreciate it. As a reminder, this webinar was recorded and will be uploaded onto Redwind's YouTube channel within the next few days. You can also find our previous recordings there from all of our grants. In closing, I'd like to thank our presenter, I'd like to thank our captioner, and I'd like to thank all of you for joining us. I hope you all have a wonderful rest of your day. I hope you all stay safe, and I hope to see you all at the next webinar.